Hi, welcome to the Northeast Georgia Center for Simulation and Innovation. Simulation is an innovative, hands-on training method that optimizes patient safety, quality, and efficiency in healthcare. Simulation allows the learners to put their technical skills, knowledge, and critical thinking to practice in a safe, realistic learning environment. All members of the interdisciplinary team can care for patients as they would in the clinical setting. We utilize sound educational principles in developing our simulations, including transformational learning theory, situational learning theory, cognitive load, deliberate practice, novice to expert, and many other learning principles, developing an evidence-based practice for simulation education.
Simulation requires active engagement in the simulated experience. Participants should conduct themselves as if they were in a real clinical environment, following standards of practice, guidelines, and ethics of one's profession. We bring scenarios to life using high-fidelity simulators, standardized patients, moulage, and equipment, just as they would have in the clinical setting. Participants should engage with the mannequins or standardized patients and any other members of the interdisciplinary team as if they were real.
Our simulations are developed utilizing clinical faculty, subject matter experts, and simulation educators overseeing each scenario using evidence-based practice. The subject matter experts, simulation facilitators, and actors immerse the learners in evidence-based, realistic, safe learning environments.
Often we find that it's easy to say what should have been done when others are observing or after the simulation has been concluded, but it can be difficult to think on your feet during the simulation. One of the reasons we do simulations is to allow for self-recognition and correction of thinking and actions. Simulation allows us to make mistakes in a safe learning environment.
We recognize that technology isn't perfect. If we encounter a technology glitch or malfunction, we ask the participants to please do their best to continue the simulation. The simulation facilitator will help provide support and help guide the scenario if something like this occurs. Any simulation limitations due to mannequin, equipment, or room setup will be clarified by the subject matter expert or simulation facilitator prior to the start of the simulation.
Our simulations include pre-briefing, the simulation, and the debriefing session. The pre-briefing will set the stage by setting goals and the expectations for the simulation. Pre-briefing comes in many modalities. The pre-briefing includes an orientation to the simulation space, the equipment, the simulators, method of the evaluation, the roles, the time allotment, the objectives, patient situation, and even the limitations.
We ask that during the simulation, participants function within their scope of practice as a licensed professional. During a simulation, the participant can feel a rapid or weak pulse on the simulator. If they want to place the patient or simulator on the monitor, they can do so, applying leads, visualizing the rhythm on the monitor. They can listen to breath sounds with their stethoscope. If the patient becomes tachypnic or other breathing problems, they can apply oxygen. If the patient requires medications or IV fluids, the participant may administer the fluids and medications through an IV access.
They may also call for help. That would be available to them in the actual clinical setting. Please utilize the simulation phone and the simulation number provided in the simulation setting. We ask that participants perform all the tasks they would in a real clinical setting. In procedural simulation, the participant should complete the entire procedure on the task trainer, just as they would on any actual real patient.
Our high-fidelity simulation mannequins can blink, breathe with chest rise and fall. They have palpable pulses. They can become diaphoretic, and some may have IV access. The simulation mannequins can talk and verbalize their physical findings, signs and symptoms, or answer any clarifying questions. Some simulations may include a standardized patient. A standardized patient is trained to simulate the characteristics of an actual patient, a family member, or any other role needed for the scenario. In complex simulations, we may utilize a standardized patient paired with a task trainer.
After the simulation, participants will attend a debriefing session. Debriefing provides an opportunity to reflect on the simulation, discussing what went well and identifying what could be done differently. Both the learners, the observers, and the subject matter experts will be asked to contribute to the debriefing. Be honest during the debriefing and provide feedback so that we may improve the simulation learning experience. All simulations and debriefings are kept confidential. The participants' performance observed in the simulation will also remain confidential.
Our goal in simulation is to enhance learning and promote high quality and safe patient care. Simulation helps maintain and improve technical and critical thinking skills to deliver best patient care to our community.